Welcome to the Moved to Meditate podcast. I'm your host, Addie D. Hilster. If you're a yoga practitioner or teacher who knows that there's more to yoga than poses, but you're wondering where to find that, come join our quiet little party. Here you'll find resources to help you deepen your practice, as well as insightful conversations with yoga, movement, and meditation teachers from a range of traditions. On this podcast, we spotlight the more contemplative aspects of movement practice. So we talk about all things gentle yoga, meditation, yin, restorative, yoga therapy, mindfulness, and more. Listen in and connect to a community of like-minded practitioners. Hello, everyone. Thank you for dropping by today. This is officially episode 50 of the podcast, which feels like kind of a huge milestone. So thank you so much for listening and supporting this project by being here and being interested in topics like meditation, mindful movement, yin yoga, and gentle therapeutics. I'm really grateful to have this opportunity to just talk about these things and to bring these subjects forward. So whether it's your first episode here or you've been listening to the podcast all along, I'm really thankful. I know that I've learned a lot from these 50 episodes, and I always get so much from the conversations with my podcast guests here. Today's interview with Dr. Tracey Meyers is no exception. We'll be talking about her new book, Yin Yoga Therapy and Mental Health, and how yin yoga can be a particularly useful and even transformative practice for supporting different kinds of mental health challenges, from anxiety and depression to PTSD and traumatic brain injury. Tracey shares a lot of nuanced insights and also very practical considerations for people looking into yoga therapy as part of their mental wellness, and also for yin yoga teachers who wish to be more mental health informed. We talk about using mindfulness meditation practices within the yin poses and how that makes meditation more accessible for many people, while also making the yin poses safer and more therapeutic. And you'll also hear Tracey's analogy of yin yoga being kind of like tofu, in that it's simple and adaptable for many different individual needs on the physical and emotional mental levels. And we also speak about exploring sensations and the comfort-discomfort line in yin poses particularly, and how over time we can use that to expand our stress resilience. I will link to Tracey's book in the show notes for this episode, and I highly recommend her book as an excellent resource on the blending of mindfulness meditation skills with yin yoga and the therapeutic potential that has. You can always find the full episode notes and resources on my website at movedtomeditate.yoga/podcast. I will be taking a short break next week since it'll be Thanksgiving in the US next Thursday, so there won't be a new episode then, but we will have more interview episodes and shorter solo talks to share with you soon. And I really look forward to hanging out with you here for the next 50 episodes of the Moved to Meditate podcast. So let's start by listening to this conversation with Dr. Tracey Meyers. Okay, hello everyone. Welcome back to the podcast. Today I am really thrilled to be speaking with Dr. Tracey Meyers, and she's the author of Yin Yoga Therapy and Mental Health. It's a fairly new book, I believe, and she's a clinical psychologist and also an adjunct faculty member at the Maryland University of Integrative Health, where they have a Master of Science in Yoga Therapy program. In addition to being a highly trained psychologist and yin yoga teacher, she's also trained in mindfulness-based stress reduction and I-Rest Yoga Nidra, among many other things, I'm sure. So she's a great person to talk to on this podcast, where we're really having conversations between the contemplative forms like meditation and the movement practices. So welcome to the podcast, Tracey. So happy to have you. Do you want to start by telling us a little bit about who you are and what your work is all about?
Yes, thank you. So as you said, I've been a licensed clinical psychologist for almost 25 years now. And most of my work was in public mental health. So I worked with a lot of folks that had serious and persistent mental health issues. things like schizophrenia, bipolar disorder, traumatic brain injury. And so I had a really kind of traditional psychological career for many years. And on the side, I was teaching yoga and starting to use mindfulness, but I kind of had two different lives. Like I had my day job and then my night job. And someone, got wind of the fact that I was teaching yoga at my hospital where I was working. And they suggested that maybe I could teach a class at the hospital. And so, very reluctantly and nervously, I started to integrate some yoga into staff meetings, and then eventually started working with clients. And that really was a turning point in my career as I began to integrate yoga and meditation, not just for staff or for well-being, but really to work with people that had serious mental health challenges. So I worked at the hospital for 17 years, doing inpatient and outpatient work, and have moved over the last couple of years to now work in a lawyer assistance program, working with lawyers, judges, law students, working on well-being, stress management, and navigating the challenges they face, like immigration attorneys and judges who are working with, lots of people with trauma. So working on a kind of a different end, but still a lot of use of integrative modalities.
I love that you're bringing these, softer and more contemplative perspectives into those kinds of institutions where it's really needed to balance kind of the way that those have been in our society.
Yeah, exactly. And at first it felt so odd to be doing yoga, and people would, I would often run classes outside and try to get a lot of people interested, and people would come by and, what is this? It felt so foreign in
Hmm.
a very traditional psychiatric setting. But over time, people really got used to, oh yeah, we do yoga. My clients started to get comfortable, doing it right on a unit, inpatient unit, and some of them would even like offer to teach it on an off shift. So you could see it start to infiltrate little by little, so that it wasn't such a strange, or odd thing to be doing.
Became part of the culture eventually.
Yeah, yeah, and like some of my best memories of working at the hospital were when we'd have these community classes where we'd have clients coming, we'd have the CEO, we'd have nurses, we'd have administrative assistants, we'd all be practicing yoga together, and it felt like these like boundaries of patient therapist and management, all those boundaries kind of dissipated at the end of a
Mm.
shavasana, and we wake up together and we're like, oh, this is like lovely.
Oh, right. We're all human beings here.
Yeah, we're all saying namaste there, and you could feel like sort of this joint feeling of cohesiveness when there are a lot of divisions in daily life for clients that live in that
Mm,
type of setting.
that's wonderful. And how did you personally start your yoga and meditation practices and yin yoga in particular? Was that like a love at first sight or no?
So it was the opposite. I don't know what the opposite of love at first sight is. But so I started becoming interested in yoga itself with one of my clients. I had worked with a client, and I write this in the book. He had a brain injury, and he was doing yoga one-on-one with a yoga teacher. And I had always wanted to do yoga, but I was very intimidated. I'm like, I'm not flexible. I can't. I had a lot of stories, like
Mm-hmm.
I can't do this. I'm not athletic. I could list like 10 stories why I didn't want to do it. But I was intrigued, and I was like, if this client who had a brain injury and was just getting out of a wheelchair, if he could do yoga, then maybe I could. Like, and I really was inspired by him. And so I actually went to the yoga teacher he was working with, and I asked her if we could do some one-on-one sessions. And that's how I began doing yoga. And over
What an
time,
amazing way to start.
yeah, it was actually, I was like so many of us, like afraid, not enough confidence, and really my patients. And this happens over and over again for me, that my patients actually inspire me to, make a change and to be willing
Mm,
to try something new.
that's fantastic. So even your personal practice was rooted in that connection to your patients and what you learned from them.
Yeah, and really what works and what doesn't work, it's so helpful because when a client will say this meditation or this practice was really difficult for me, it helps me to then recognize, oh, okay, so I need another option when I'm sharing this. Um,
Hmm.
for example, when I teach a loving kindness practice, either in a yin pose or just as a grounding or seated meditation, most of us say, "Oh, how lovely. That must feel so great. And that helps us feel connected." But I've had clients say, "I don't have anyone that loves me." Or, right
Mm-hmm.
now I'm going through so much trauma. I can't even tap into that. And so I
Mm-hmm.
recognize, oh yeah, it's really important to give lots of options, because what seems like it would be so beneficial for one person may not be.
Yeah, the loving kindness practice is a good example of something that can be kind of confronting and can bring up a lot of the feeling of absence of loving kindness, before we
Right.
get the healing benefit of it.
Right.
Yeah.
And if we don't name that potential, then people can
Hmm.
feel like even more isolated, or something's
Hmm.
wrong with me, because why am I not
Exactly.
having this transformative
Hmm.
experience? Yeah.
Yeah. Yeah. Well, since we're talking a lot about yin yoga today, just in case any of our listeners are new to yin yoga and how it's different from the more active forms of practice, I'll kind of give my quick definition is that it's a meditative form of yoga where we hold the poses for a few minutes at a time, pretty much mostly on the floor, and we use support like blankets or pillows or bolsters as needed to make those poses sustainable for that length of time. And in my experience, when people think of yin yoga, a lot of times they think about the physical stretching aspects, maybe the effect it has on certain tissues of the body, whether they've heard that's a good thing or not so good thing. But you are really looking at yin yoga from a different perspective. So can you give us just a little introduction to some of the potential mental health benefits of yin yoga?
Yeah, I love your description. And one of the things about yin that's so interesting is that it can affect our system on different levels. Like you were describing, the physical practice, right? Influencing the fascia, the connective tissue, um, maybe producing more flexibility or ease in movement. And then we can look at some of the more subtle things energetically. What happens when we're working for longer periods of time and pressurizing different parts of the body. And then psychologically, which, like you said, is really this area for me that I'm fascinated with, is what happens when we tune into what's happening in the body, controlling the level of sensation ourselves, right? And then taking the space to really work on adjusting our breath, looking at our thoughts, working with difficult emotions in this kind of posture. And, it's a really interesting interplay between mind and body. And, the other piece around yin yoga specifically is that it's so accessible, that we don't have to be a yogi, and we don't have to be super flexible to be able to take a shape and stay for a while. So for people that may never have done yoga, or have some of the fears that I had, which is I'm not flexible, I can't do this, it's gonna, I'm gonna hurt myself. When we take a gentle shape and we stay in it for a while, most people have the capacity to find one for themselves.
Absolutely. And I think that's starting to, explain a little bit of about why you're emphasizing yin yoga versus other forms of yoga. Like, do you feel like with yin yoga there's a little bit less of the comparing to the person on the mat next to me? And can you talk about that a little bit?
Yeah, yeah. It actually came from my own experience too, because when I started yoga, after I got over my initial fear, then I went to this other place of being very, like, kind of power yoga focused and peak pose focused, and I wanted to be as good as the teacher, and then let me get my teacher training, so I could feel that energy of really intensifying my practice. But all of us get injured. It can be challenging, and that isn't for everyone. And so really this recognition how a yin practice with poses that are simple, with the ability to regulate ourselves, and we don't have to compare, because everyone's going to look different. Each person, if we're asking them to find a level of sensation around a 2 or a 4 on a scale of 1 to 10, they're going to look different, because a 2 for you might be a 4 for me, and vice versa. Or I might be propping to stay safely in the pose where someone else doesn't need a prop. So we're all going to look really different. And I think that frees us up from that yoga journal. I have to look like the teacher, modality that many of us have struggled with.
Yeah, absolutely. And, given that we're holding the poses for a longer period of time, we've given ourselves the luxury of time to adjust things and to really have each person make the pose their own and to kind of like find their way through that and figure out what feels right on that day.
Right. I mean, and I'm sure you have the same experience. Nothing makes me happier when I see everyone looking different. If I'm teaching a yin class and everyone looks different
Hmm.
because everyone's taking care of themselves. And so there's that like sort of internal experience rather than externally looking and judging and comparing.
Exactly. That makes me feel like I've done my job in explaining what we're doing here and how to use all of these props and equipment and
Yes,
stuff that the people have really availed themselves of those tools and have really found something that's working for them.
exactly. Yeah.
Yeah, I love that. And also that, in yin, we sometimes we close our eyes, we get relaxed, or we are looking down in a way where we're not really referring to even what the teacher is doing or the students are doing next to us.
And I think that's you started by saying the quiet, you were stressing the quiet aspects of yin, and that's really what the quiet means to me, which is this turning inside. That doesn't mean inside it will be quiet. Like we know that sometimes if we're in a pose, we can feel quite agitated or we can feel energized, all, the whole range. But we have to quiet enough to know what's happening inside. And I think
Hmm.
that that turning in is really the first entry level into shifting how we feel emotionally.
Yeah, I love that. And then, you talk about, and I do this as well, using the yin poses as an opportunity to teach basic mindfulness skills and mindfulness techniques. So we're not just leaving people in that silence and stillness and potential, mental agitation or unfamiliarity, but we're giving them tools to use almost like a meditation within the
Yeah,
yin pose.
exactly. And when I teach yoga teachers how to teach yin, and I think it is really important to learn how to teach yin because like you shared, if you just put someone in a pose, an easy pose like bound angle, Baddha Konasana, it could seem like, okay, well, that's easy enough, so, and then just, use your timer for 5 minutes. But that could be very destabilizing because left with our own, minds maybe starting to churn, or maybe the sensations are too strong. We want to give our students these safe cues and prompts. And one of them is, like you said, mindfulness, because we know that mindfulness helps us to stabilize our minds, helps us to come back to the present moment, helps us to even be aware of what's happening. Sometimes, we might do a yoga class where we're actually going too far in a pose, but because we're racing through and we're just trying to focus on the teacher, we don't even know, or we're not even noticing the
Hmm.
cues. So that
Hmm.
mindfulness helps us to really be safe in a pose as well. So that is really, I think, one of the really important ingredients when leading yin.
I totally agree. And I think this is maybe one of the places where the disconnect is happening when people are like, I don't get it. What are you doing in these
Yeah.
yin poses? Because this ingredient of awareness and learning skills of awareness is very important.
And for many of us, meditation is hard to do. And
Hmm.
so, it's just sitting and not doing a lot for so, especially people with mental health issues, can feel like impossible. But in a
Hmm.
pose, where there's physical sensations happening, there's, maybe other people around or the support of a teacher or yoga therapist, um, then and a time limit, then it becomes more accessible. So I found many people actually learn a meditative practice from their experience in yin because they're doing
Yes.
it 5 minutes, 5 minutes, 5 minutes. By the end, you've now done 60 minutes of mindfulness practice in addition to yoga.
Which is probably more than you could do if you were just, sitting traditionally in meditation, for your
Yes.
10-minute practice or your 15-minute
Yes,
practice.
for sure.
Yeah,
Yeah.
because we're doing it within the pose. And, like you, I love teaching mindfulness of breathing or mindfulness of body sensations or even leading a body scan during a yin pose. But you also talked about in your book leading inquiry practices
Yeah.
or dropping in inquiry questions during that time in a yin pose. So, can you give a few examples of how you might do that or what those questions might be?
Sure. So inquiry is this idea that we start with a question we don't know the answer to. Because and when you think about that, that's actually really important, because if we knew the answer, then there's not a lot of new learning or insight. So for example, if I'm in a pose and I say, why am I so inflexible? Right? Which I've said. Well, there's not really an answer. I mean, like, okay, well, you are, or this is because you've done too much running. Whatever the story is, there's no new information to glean. It's really a judgment, right?
Hmm.
And so when we ask ourselves questions, we want to really not know the answer to it and have a generous and warm view of ourselves, a compassionate question. So inquiry starts with a question, but it's in a non-judgmental, compassionate way. So, for example, we're in a pose. Let's take our bound angle pose, which we say butterfly in yin, to talk about how it's like a little bit different than a traditional bound angle pose. And I might start with a very, very basic inquiry question like, what's happening now? What's happening now? And then I might prompt, what do you notice in the physical body? So, curious questions, not judging, just really like, what's happening? And then, other questions might be, what what level of sensation is present right now? Where do I feel it most predominantly in my body? Are there any emotions here? What do I notice when the pose goes on for a minute or 2 minutes? What's happening now? So these are like inquiry questions, and they're gentle, and I might lead, I don't usually do all of those, but I might do a few of them. And I might ask the students to even choose which questions they would like to look at, because maybe they have other things they want to explore that I might not, know or suggest.
Yeah, I love that. A question is such a great way to lead with curiosity and to open that space of possibility of not knowing, of not knowing the conclusion and
Yeah.
seeing something new, seeing something different. When I would imagine when you do this with a group, everyone is, reflecting silently. But when you work one on one with people, do you ever have this become like an out loud dialogue where you hear, what they find when you ask the question?
Yeah, great question. I do. And I'll invite them to have that choice, to either speak it out loud or if they want to silently note it to themselves. And that gives people the opportunity. Sometimes they don't want to share the story, or if they're having struggles, but they might want to just know I'm there, supporting
Hmm.
them. But often people do find it helpful to name it out loud, to say, yeah, there's struggle here, or, joy, or, oh, pain in my ass. And to actually, as they're saying it out loud, they start to notice the changes, because over five
Hmm.
minutes, and 5 minutes isn't like mandatory for yin, right? It can be 90 seconds. It could be 5 breaths, even. It could be up to 10 minutes. So I want to really say that that's customized based on what the person
Hmm.
needs. But really that idea that you can notice it and name it, and that helps to then begin to explore, how do I work with this, right? So we ask the question, we check in and see what's happening, we name it, and then what would be the next way to work with it? Sometimes I'll ask, how is that to notice? How is that to notice? So if someone says there's anxiety here right now, I might say, how is that to notice? Well, it's actually it's I'm not sure what to do with that, right? Someone might say, and then I might say, where do you notice that in your body? The anxiety or the not knowing. So we can go deeper and deeper into the inquiry when we're doing it out loud like that as well, which can be really lovely.
Yeah, because giving you a little bit of a window into their experience allows you to guide your next question in a more tailored way because you just have more information about how to support
Exactly.
the person as they're going through that process.
But the cool thing is, and I love exactly like what you're saying. Ultimately, though, they are navigating, like they are doing the inquiry. And
Mm-hmm.
so rather than me, so I'm not the expert yoga therapist or yoga teacher. It's really their internal experience. And so while I'm using what they're saying to maybe ask some additional supportive questions, it's their work. And I think that's really empowering for our students that they can find their own answers. We're not trying to get anywhere. That's the other
Right.
piece of inquiry I want to say too. It's not like we're trying to get to something necessarily. It's just like this open curiosity of what will unfold when we stay embodied, right?
Mm-hmm. Mm-hmm. Absolutely. It's important that even you as the teacher don't have an answer in mind when you
Yes,
drop the question in.
exactly. And sometimes we have an agenda. I mean, the agenda might be I want my client to feel better, right? I want someone to
Mm-hmm.
feel more ease, but that doesn't always happen. And so it's important to keep our agenda in check, even if it's there, because ultimately, sometimes we don't have a great experience. My first yin class, and I wrote about this in the book, I hated it. You asked in the beginning, how did you get into yin? I forgot to say, like, I didn't like yin very much. In fact, I found it really evocative and agitating.
Mm-hmm.
And
Mm-hmm.
and there was something there that was interesting to me, but evocative and irritating at the same time, and so I didn't have a great experience, but I was curious and I was like, there's something here. Rather than wanting to not ever do it again because it was terrible, I was like, okay, this was agitating. I wonder, what was that?
What's up with that?
What's up with that? What's up with me too? And not judgmental, but like, what's up with why is this particular pose and why am I feeling, restless here and feeling comparing mind coming on or what? So it gave me some places to kindly explore, in myself.
Yeah, it's surprisingly revealing at
Yes.
times. And I find with teaching yin that certain themes come up, and you're kind of touching on some of those, like for example, being willing or able to soften. It's not always easy, to drop the doing, to slow
Yeah.
down, how noticing how you react to discomfort, like you were just describing, or even, are you willing to accept support if someone offers you a block, or do you reject
Yes.
support?
Yes.
What are some of the themes you notice coming up that you can work with?
I mean, all of those. I absolutely agree with that. I wanted to highlight one of them because that's really, I think, the heart of what strikes me as being such an important therapeutic aspect of yin is the discomfort comfort place. And
Mm-hmm.
so the idea in a yin pose is we can regulate how much sensation by deepening in or backing off or propping, right? Or taking a different shape altogether if the shape's not landing for us. And as we start to work with our comfort, discomfort, right, we can start to regulate like, okay, right now I'm on a scale of 1 to 10, I'm at a 2 or 3. Okay, if I go to a 4, what's that like? Can I be with that, right? Starting to play with that comfort, discomfort. Some days people are like, I can't, you know what? I'm stressed enough. I want to feel a lot more ease today in my body. And some
Mm.
days we feel like, wow, I'm really feeling capacitated. I'm curious. This edge is feeling really interesting, right? But that whole comfort discomfort plays a role in our emotional life too. And for so many of us, when we're working with challenging emotions like anxiety, for example, we don't want to feel it. And in fact, we try to push it away because it's so uncomfortable. And the more we
Mm-hmm.
push it away, often it actually gets more and more intense for us. So, by learning how to work with the discomfort comfort line in our bodies and yin and our minds, we start to have more tools than when we're feeling an emotion that we might struggle with. We start to be able to work with, oh, I can be with this too. Oh, this is edgy, but I know how to work with edginess now. So we start to learn, and from a neuroscience standpoint, we start to wire patterns of like, oh, this is what I do when I'm uncomfortable now. I can
Mm.
soften, I can take some breaths, I can bring some inner resource to myself, like a hand on my belly and a hand on my chest. So we start to develop that capacity because we're working in a safe discomfort comfort zone.
I love that. It's like you're using the slight edginess of a yin pose, which is different than, like, say, restorative yoga, which can look a
Yeah.
lot like yin, but in restorative yoga, there's very little stretch sensation encouraged, right? More on the comfort and the rest side.
Yeah.
And so you're using like that slight edginess to help bring forward that opportunity to kind of encounter it in the body and learn how to work with it there. And then that's a skill that can be applied with, habitual thought patterns or with an uncomfortable emotion comes up. I'm sure that's a
Exactly.
delicate dance with people.
It is. And that's, I start, so I talk about this idea of titration, which is, with medicine, we sometimes titrate a dose up, like we wouldn't start at a full dose of something. We would want to be careful and see how does someone tolerate, let's say an antidepressant or something. But in yin, we can titrate sensation. And so when I'm leading people in the beginning, I like to stay in a more like kind of that safer zone of, again, if I use that scale of sensation from 1 to 10, like a 2 to 4, so
Mm-hmm.
that people's nervous systems don't go into a hyper arousal. Because if
Mm-hmm.
you've had that experience, and I think this is what happened in my first yin class, I was in dragon and I was so miserable because I was probably maybe at like a 6 and I was doing it too, like I wasn't propping. And we stayed in, we did 3 versions of dragon and I was so miserable. I was probably like, I was sweating. So I was like maybe 7, even at a 7.
That's an intense yin pose. It's one of the
Yes.
more intense.
And that's how I started. I dropped into that. So I was like miserable and my nervous system was in a bit of a hijack of fight or flight. And that,
Mm-hmm.
although I was curious, I was pretty miserable. And I, had I not been doing yoga for a while, I would not have done yin again because I was like, I don't like this. And my nervous system didn't like it. So your delicate dance is right. We want to find a place where the person can figure out that level and feel like they have complete autonomy to shift it and dial
Mm-hmm.
it back, so that customized, non-competitive yoga that we're talking about so that we don't get into that alarm system because then we're not in the learning mode. Then we're like, I'm out. I want to get out of here.
Yeah, it seems like really wise to start gently, especially with a new student, because, or if you're the student with a new practice, because you don't have a trust yet. You need to start
Yeah.
to trust the teacher, the therapist, trust the practice itself before you can really embrace that kind of challenge in a productive way.
Exactly. And I think with yin, which is another, sort of difference between more traditional yoga, is that often we feel the effects a day later, even, or 2 days later, both physically and emotionally. And that's why it's another good reason why to start slow and do a few poses or maybe not do the whole 5 minutes. And I talk in the book about like some particular, like, let's say, for example, someone who's had trauma and may not have done yin for a while or ever, and getting into a
Hmm.
pose for a period of time could be pretty activating. So we might titrate and do 5 or 10 breaths and
Hmm.
take 2 shapes and see what happens. How did that feel? The next day or the day after. So I like this idea of a slow integration rather than, maybe a traditional 75-minute yin class right off the bat, which could be a lot.
Yeah, it really could be, and depending on how it's taught and just the vibe of the room and all
Yeah,
of these different factors, they vary quite a bit with yin yoga, which can be one of the challenges, I think, in communicating what we're trying to do here.
it's a good point. When I teach a yin teacher training, I have my students go check out at least 2 other yin classes with different teachers. And
Hmm.
I am always amazed when they come back with their feedback about how different classes feel. Of course, teachers are different, and that's
Hmm.
great. But the feeling tones of the class and their level of safety and their level of insight and integration really varies from teacher to teacher, particularly if people haven't had a lot of yin training. So
Hmm.
students will come back and say, "Ugh, that felt uncomfortable," or maybe even unsafe sometimes.
Yeah, I think that there's quite a few people with definitely good intentions, but they're teaching, they don't have formal training in yin, which would
Yes.
would probably help
It
quite a
is
bit.
because the poses are easy to teach. So if you look at the sheet of
Hmm.
poses, you're like, if I'm a
I can do
yoga
that.
teacher, I can do that, and you can. But the nuances of safety
Yeah.
and the ingredients we're talking about today, inquiry, the level of sensation, mindfulness, like that requires some understanding in one's own body first to be able to teach that safely to others.
Absolutely. Yeah, we have to embody that in order to teach it, and we have to have experienced that to know that
Yes.
ingredient is so important.
Yes, exactly. Yeah.
Yeah, and going back to we were talking about the kind of using that edginess skillfully, in a yin pose without, pushing people towards being more yang or playing into those habit patterns of like overdoing or always having to do the most, to get the full benefit or all of those stories. This way that you're working with this edginess, would you say it's like a way of helping to expand our window of tolerance or like build our stress resilience?
Exactly. Yeah, the window of tolerance is a really important concept. It comes from the trauma folks like Daniel Siegel, looking at the neuroscience of trauma and what happens in our nervous
Hmm.
system. And we know from the research that repeated stress and repeated traumas, especially early in one's life, shrinks our window of tolerance, which really refers to our capacity to manage day-to-day stressors, right?
Hmm.
And so if we have already a window of tolerance that has been diminished by trauma or stress, it doesn't take much for us to be thrown off balance or to go into a hyper arousal.
Hmm.
And so, that capacity to come back to our window of tolerance can be elusive if you're just stressed all the time and are almost always in a fight or flight. So in yin, where we can play the edge, find a little discomfort, maybe we pop up into that hyper arousal, but then we, with our breath or with a gentle, maybe even loving kindness touch toward ourselves, we find, oh, okay, I can ride that wave, and that window of tolerance starts to expand because we're
Hmm.
in a little bit of discomfort, yet we're with it, and we're not in a fight or flight. So repeated patterns of being able to tolerate gently with a kind, approach toward oneself, we can expand that window of tolerance. And that can be vital in terms of daily stressors, because stress isn't going away. And when we work with stress management, we want to really have a robust way to work with stress rather than trying to avoid stress.
Yeah, absolutely. And I think it's giving us this like context where we have a clear pathway for how to get back home, like how to re regulate on our mat. We're really getting to build some confidence that, oh, it's okay actually if I have a stressful moment because I know how to reset. I know how
Yes.
to come back and find that resilience again.
Beautifully said. Yeah, I love to when I teach yin, and I'll ask you the same question. But after a pose, often I'll lead students into a rebound pose where they just
Hmm.
rest. So they might come out of bound angle and come into shavasana, and that moment of noticing tension and then release. And
Hmm.
I think that's kind of what you were suggesting too, of like, oh, okay, so this is what tension feels like, this is what release feels like, and I can now do this on my own because I've felt it. Like we have a direct felt experience in the body, and that gets imprinted, so we know how to do it and how it feels in the body to do it.
Yeah, and then it's like there's less fear and dread of stress itself. Like,
Exactly.
I don't know,
Yes.
like when I've had anxiety, I get anxiety about anxiety. Like, I'm afraid that
Yes.
if I do this, it's going to make me anxious and set me off. And so it becomes this
Yeah.
whole feedback loop. And what has helped is just becoming more confident that like, okay, if something hits me, that's okay because I can make my way back to my baseline. I can sort of find
Yeah.
my way home again.
I love that. Yeah, like learning, and even I will sometimes say this as a sort of a repeating statement one can say in a yin pose is like something like, I can be with this. I can be with
Hmm.
this for now. Something like that. And maybe I'll have a
Hmm.
student put their hand on their heart while they're in the pose, and while the sensations might be a little intense, maybe it's at the end of the pose. I can be with this for now. So something gentle like that, and that confidence, like you're talking about, that confidence of navigating a wave of anxiety, which is inevitable for all of us, right? That like, okay, I can be with this. It doesn't feel good. It's kind of unpleasant, and I can be with this. And I know I've gotten through this before.
And it's such an art form to really start being able to discern, when do I have the capacity that I can be with this? And when do I actually need to shift my attention to something else? Because this is actually just amplifying the
Yeah,
reactivity, and this is just taking me out of the window of tolerance. And so, I mean, I've learned some of those as quote channel changing practices where, we might shift our attention to something else, something more external, or to loving kindness phrases if they work for us, or something else. So, can you talk a little bit about that? Like, kind of knowing
sure.
when to turn towards and when to change the channel?
I love that. Yeah, I think about we can use the senses as one of those channel changing mechanisms. And so, like you said, you can if you are in a place where this doesn't feel manageable, or the activation or the negative thoughts are starting to increase to a point where it actually feels like it's going to cause more distress, we could start with the senses of opening the eyes, noticing what we see, using the hearing sense doorway, the smell. So there's a lovely practice I like that's a grounding practice called 5 4 3 2 1, or using the
Hmm.
senses. And so I've had clients who will have be my maybe in the grips of a panic attack, and I'll say just gently, okay, opening your eyes and noticing 5 things in the room. Can you name them out loud for me? And then 4 things that you feel you can touch with your hands, 3 things you hear, 2 things you smell, and 1 thing you taste. And so as we get into the sensory input, we're back in the present moment often. So
Hmm.
that can be a nice doorway. And then sometimes another channel changer is the breath. Like we can cool the nervous system with a mindfulness practice, cooling it down by just coming to the next breath. Let's come back to in breath and out breath. And then sometimes that resource, which might be a safe place, so some of the psychotherapy models talk about a resource where maybe it's a visualization of our bedroom or a beach scene. So we can even utilize that as a regulation tool if we're feeling like we're out of our window of tolerance.
Those are such important tools to have in our pocket, and to really just kind of learn how to sense where we are on that continuum of resilience at any given moment.
I was talking to some folks with a traumatic brain injury a couple nights ago. We were talking about soothing some of what we're talking about. And one student asked a really good question. They said, I know some of these tools, but I can never remember them when I'm really activated because I'm
Mm,
so distressed. I forget. And so we talked about how when we're most stressed, it's hardest to use these techniques. And so actually by practicing them, and here's another like kind of yin idea of like practicing some of these stress or emotional resourcing when we're not stressed, when we're in a yin pose and we feel okay, we could still do that 5 4 3 2 1, or a cooling mindfulness breath, or some gentle self supported touch. So I like to do it proactively so that
hmm.
we actually know it in our system, and then it's much easier to draw upon it when we're activated. So we need to practice it both in calm times and stressful times to make it really stick in our system.
That's such a good point. Like, we have to train. We have to train
Yeah,
ourselves that this is
we
how I
do.
respond, and we need to train when the stakes are low.
Yes.
you know.
Well, because we learn better. When we're in a fight or
Yeah.
flight, our capacity to learn new information is really diminished because we're more of in a survival. What do I need to
Mm,
do to get out of this situation? And so we're
hmm.
not typically, taking in new information, remembering it, saying, "Huh, this might work. This might," like that's not usually within our repertoire at that moment.
Yeah. You have chapters in your book about different, forms of mental health challenge, like traumatic brain injury that you've mentioned, schizophrenia, anxiety, depression, trauma. We've talked a little bit about anxiety, which is one of the most common challenges. Can you talk a little bit about depression, also very common, and what
Mhm.
yin yoga has to offer for that challenge?
Yeah, I have so much gratitude for working with people that have serious challenges with depression. So, many of us have depression, right? It's second most common psychological condition after anxiety. And so most people we know have experienced some level of depression in their life. But when you work with people with debilitating major depression, with suicidality, for example, we're talking about folks that have often very slow motor systems. They're often not, if they're in the grips of an episode, able to even get out of bed very easily, move, or want to do practices. So when I started doing yin at the hospital I worked at, I really found that sometimes I had to be creative and get people to work in bed. So when people had
Mm-hmm.
depression and they're like, I'm not going to class, or I can't get out of bed, or they weren't even really talking very much, I might just
Mm.
offer a gentle shape and do some breathing with them while they were in a reclining twist, for
Were
example.
you on the phone with them or something?
No,
How
I was
did
in
you
the bed.
know?
I was in the room. No, I was next door. So when I worked, so I would literally be. So they would be like in a hospital bed, for
Oh,
example.
okay, okay. Got you, got you.
Yeah. So we
So you
would
could
be in the
visit.
bed. Yeah, I could visit, and I'd say, "Can we take your pillow and put it between your knee?" And so we would
Mm-hmm.
start there. And what I found with people with depression, particularly the floor-based or bed-based poses,
Mm-hmm.
started to be like a way to build a little bit of energy into the body. So,
Mm.
with lower energy, yin is a really nice platform just to build in a little bit. And I might, for example, if someone's starting to feel a little more energized, maybe we do a little bit of coherent breathing or bringing a little bit more energy into the breath. Even a very, very gentle Kapalabhati breath, a back, little amplification of breathing to energize the system. So, I think yin, and also from a psychological point of view, we might be doing a lot of compassion practices in those
Mm-hmm.
moments of really trying to befriend a person's, experience and not judge, because people, when they're depressed, often have a lot of self blame and criticism. So, looking at the heart practices, the short, easy physical practices, and breath work together can be really helpful for depression.
It's so interesting because I've tended to think of yin as like kind of a calming practice because it's slow and like how it can downregulate the nervous system. But this is really an interesting point that, if someone is in kind of like a hypo-arousal depressed state, that this is a kind of accessible way
Yeah.
to bring any kind of, feeling of aliveness into the system.
Yeah, I think that numbing or that disconnection, and we see that not just with major depression, but with traumatic brain injury, sometimes physically disconnected, or with post traumatic stress disorder, when there's just lack of integration with what's happening in the body. To be able to be in a gentle pose and even have your hand on your belly and your hand on your chest, or a hand on a part of the body to physically feel the body, we start to reintroduce that capacity to be connected to the body signals in some way.
Yeah, that's amazing. It's amazing how versatile this yin yoga practice turns out to be, even though it looks so simple.
That's I have the same thought, and I talk about this idea of yin is like tofu, right? Which is like it can be, and if you like tofu, that's, but for many of us, we struggle, but we get in our tofu by seasoning it with what we love. And
Hmm.
so, a pose like bound angle might be, kind of bland, like tofu. But then we sprinkle in loving kindness, or we sprinkle in pranayama practice where we're doing, some integrative, coherent breathing, or we do a visualization, right, of maybe a compassionate friend who's with you on your journey. And then suddenly it's
Hmm.
spicy and it tastes like really yummy. And so I love to think about how we're going to season it based on a person's need.
Yeah, it's like a great canvas for whatever is
Yes,
needed. I love it.
exactly. Yeah.
You know, um, you also talked about, when it's challenging to drop right in to a yin pose, like maybe the system is really activated.
Hmm.
Maybe there's anxiety or there's trauma that comes up in the stillness. And that, kind of alluded to this, I think, with a few of the stories of clients who needed to sort of get to the yin through the yang and maybe do a little bit of movement first to kind of create the conditions where all
Yeah.
this magic can happen in the yin poses. Could you
Yeah. I
talk a
talked.
little about that?
Sure. I talked about a couple of clients. One client in particular, Jack, who um, suffers from PTSD, and he loved vigorous yoga. He came in as a yogi already and doing, lots of vigorous practice. And so he got so agitated with yin. And he really got angry. I didn't think he was ever going to come back because he was really mad at me for putting him in a pose. And
How dare
and
you?
how dare you? And this is so awful. And why would, I want to move. And so, we worked with that, and thankfully he did come back. So he, like me, maybe had that little bit of curiosity of why was it so frustrating. And what we recognize is he needed to move in the beginning. Like, he could not come in from lots of anxiety and feeling a little activated, in terms of trust and wanting to be even in a room with somebody so intimately. And he needed to like move that energy through. And so often when those folks come into the room, we don't start in a yin pose. We don't even start in a centering pose. We might just start right in doing some mindful movement, and it could be as vigorous as the person needs to help. And we might not even get to the yin part till halfway or 3/4 of the way through. And then we titrate. And this is what I did with Jack, like one pose. And I had him pick it to give him like the safest vehicle. I think he picked frog, right? Like something that was still pretty intense. And then gradually over time being able to add more in. So if someone's coming in hyper aroused, it can be really challenging to do even a centering practice. So good to ask them, would you prefer to move right now? Even like a walking meditation is another doorway. I'll say, let's move. Let's do a little walking meditation to begin to connect with our bodies and our breath, but we're moving. So it's a little less agitating if the nervous system gets to move and get a little of that energy out.
It makes total sense. And, even just an ordinary busyness when we come in. Like, I used to teach a Friday night 6 p.m. yin yoga class in my studio
Mm.
in LA. So when people have to get somewhere at 6 p.m. on Friday in LA, it's a thing.
It's a
And
thing.
they would be working hard to get there and, fighting traffic and kind of making their way down the freeway. And so they would come in at one state of, kind of jangled just from it being the end of the week and the end of the day and getting in the car and all the things. And so, I always started with a little bit of movement, like warm up poses, gentle stuff to just sort of like, okay, we're here before we would drop into the yin poses, because it just felt like hitting a brick wall if I
Yeah.
asked them to get from the car into butterfly pose.
Exactly. Love it. Yeah. And such a good intuit, and you could feel the energy in the room, right? Of people frantically
Hmm.
running in, worried they're late. And so I love that
Yeah.
idea of being, flexible as a teacher and as a yoga therapist. I tell my yoga therapy students, they will often come up with the most intricate, beautiful yoga therapy plans. Like, okay, in this session, I'm going to do, and it's so beautiful. I'm like, wow. But then they'll have a client come in who's agitated or who is depressed and doesn't want to, or who's in pain and they don't want to do anything. And so we talk about, well, what can we do? And that's where yin comes in again, because often, even if a client can't do all these therapeutic yoga practices that the student might have designed, they can take a shape and do some breath work and start to work with some of the levels like we're talking about today of emotional, energetic, and breath work. So there's always something that can be done when we have a yin pose to work with. So I like that idea of flexibility with whatever's showing up in that moment, and really looking at our students and having them tell us what they need.
Yeah, it's like a dialogue. So beautiful.
Yes. Yes, exactly. Yeah.
Well, I've loved this conversation, and I'm wondering if there's anything else I've missed that you'd like to add that's really important for us to consider, in this world of yin yoga and mental health.
Yeah, I think, like what we've been saying, that yin done with someone who is comfortable leading skillful practices like mindfulness meditation and loving kindness, like that it can be transformative, because it's teaching emotion regulation, self-compassion, and like you were saying, a resiliency. I can be with this now in the pose, and I can be with this in my daily life. So I think that yin really has a lot of possibility, and in our day and age with so much stress and so much mental health challenges, that we need these tools and these relatively simple practices to help people feel more and more empowered to do their own work, so they don't have to rely on therapists or medication or other things, which are fine. But we often, really need to find our own level of support inside of us.
Yeah, that's so inspiring. And thank you for your work and everything that you're doing to kind of promote these wonderful possibilities of the practice.
Oh,
And I
you're
will
welcome.
link to your book for sure in the show notes. But do you want to tell people a little bit about the book or where else they can find and connect with you?
Sure. Yeah. So the book is called Yin Yoga Therapy and Mental Health. And it is an overall description of what we're talking about today, how to use yin therapeutically. And it's really designed for yoga teachers, yoga students, yoga therapists, and also mental health providers who want to start doing more embodied practices with their clients. It can be found on Amazon and Barnes and Noble. And the publisher is Singing Dragon. And you can purchase it through them. And I have a website, TraceyMeyersSci.com, where you can see different things, like I'm doing a yin yoga training in Charlotte in March, and different presentations
Nice.
and workshops that I'm doing. So feel free to reach out, and you can find me there as well.
Wonderful. Well, thank you again for taking the time to share all this wisdom on the podcast. I really appreciate you being here today.
Well, thank you. I'm so excited about your practices and what you're offering.
So that's today's episode. If you enjoyed this conversation, please share it with a friend and or leave us a review on Apple Podcasts and help others find us that way. To learn more about my work, the Moved to Meditate class library, live online classes, teacher trainings, and private lessons, go to movedtomeditate.yoga. Thanks so much for listening.